Maureen, thank you again for all that you're doing. How are you feeling physically and mentally?
Hi, Stephanie. Thank you so much for having me. I am doing okay. I think that the further we progress in this whole situation, the more, we all kind of muddle through and find what is starting to look like our new normal. And I think that's just what we're all trying to figure out.
Well, sadly, a month ago, your normal, the initial surge, you described as a war zone in the ICU. What's it like now?
That's always such a hard question. It's really difficult to paint a picture of what it's like in hospitals right now. Especially in the ICU, we are still very full with a lot of patients who are very sick with COVID-19, but we are also starting to be able to kind of make room and rework things and really have an increased capacity for other patients. It's still kind of strange not to have families and visitors there, but I think that we have done a really, really good job of starting to try to figure out how to connect with patients' families better, how to connect with visitors better. Again, it's kind of that whole trying to figure out a new normal right now.
Maureen, take me out of the hospital and take us to your community. From where I sit, we've seen the armed protesters in Michigan. We've heard all the anger in your state. Can you help us understand what is actually going on there? Because you're someone who's putting yourself at risk every time you go to work.
I think that the situation that we're facing right now is something that none of us have ever imagined having to face. The world has been put on pause, and on every single side of that, that's a terrifying experience. Regardless of whether you're in the hospital or you're at home, people who are unemployed or just in so many difficult situations. I think that for people who haven't had exposure to the hospital side of things, who haven't been inside the walls of a hospital, who haven't had a loved one affected or themselves affected, it's very difficult to understand what that looks like. And from a healthcare perspective, we are not immune. Everybody is feeling the effect of this pandemic, financially, emotionally, physically, mentally. I think it's strained everybody, and clearly everybody is at somewhat of a breaking point right now.
What do you want people to understand? Everybody wants to get back to work. You've got some businesses opening later this week. But what do you want people who are so angry right now and feel that their rights have been taken away? What do you want them to understand about what this disease does and what it's like inside a hospital?
I think it's really easy to always be able to see our own perspective, to feel our own fear, to feel our own pain. It's also very easy to blame somebody else or to find fault in the way someone else does or doesn't do something. And I think that in the midst of all of that, it's so important to always go back to the heart of things. And I think that's how anybody in healthcare has gotten through up until this point, is sticking to the heart of things and treating every patient like they're our own family member. And so I think that's what it really comes down to is, understanding that we're all in this together. We're all hurting in different ways. And no one wants to see anybody's friend, family member, mother, daughter, brother, cousin, grandfather get sick or die from this terrible disease. But none of us want to see anybody suffer at home either. We're still all in this together. And that's all I really have.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.